Hello, countrymen and women. Speaking before you is Edward Puri, a peer educator at Shalimbana University, and we will be talking to you about abortion. And what is abortion? Abortion is a termination of pregnancy before it reaches its 20th or 24th week. Now, this happens in two ways. It can either be intentional or unintentional. The unintentional way is when you have a miscarriage, and the intentional way can either be done safely or unsafely. And I will be talking about the safe abortion. Why am I going to be talking about this? Because according to the Codes Act number 26 of the 1997, it permits an individual to have an abortion, but on a certain condition, and which is why I'll be talking about the safe abortion. Safe abortion, this is when you terminate your pregnancy with the presence of the healthy professional who is trained in that area. And how is this safe abortion done? It is done in two ways, through medical and through surgery. If a health professional, a health worker, such as a doctor, nurse, or a midwife, can give you medication that will allow you to terminate your pregnancy, or they can undergo or they can do surgery on you. And what are some of the characteristics of a safe abortion? They are low risk to your life, meaning that there are ways in which your reproductive organs will be protected or preserved through undergoing a safe abortion. And my colleagues will talk to you about unsafe abortions and where to go for this abortion.
Countrymen and women derived from all sectors of society. This is Herod Besesai, peer educator, found here at Shalimbana University speaking. So I'm going to present to you on some of the ways through which unsafe abortion is done, or the practices that people get to use for them to do unsafe abortions. So when we talk about unsafe abortions, these are abortions or rather termination of pregnancy that are not legalized according to the law of Zambia. One of it, you see that a lot of people start abusing drugs. For instance, to take Panadol overdose, or rather mix Panadol with Coca-Cola and drink that. That's definitely unsafe, and that would lead to termination of pregnancy. Another method that people get to use, we have an aspect where they start injecting substances in their vagina, all right, so that they could pull out the fetus out by force. That is also not safe, or rather unsafe practice of abortion. Now, why are we saying that these methods are unsafe? Number one, they can lead to death. Number two, they can lead to infertility. And number three, they also lead to severe blood loss. And this severe blood loss can bring on board other complications such as anemia. So that's no reason as to why we as peer educators are educating the public out there that unsafe abortions are very bad. I submit.
Hi everyone, my name is Tawata Mono. I'm a second year student at Chalimbana University pursuing Bachelor of Food Science and Nutrition, and I'm a peer educator. So, I just want to continue explaining on where to take cases of abortion. So, there are four main places where you can take cases for abortion. The first one, you can take cases for abortion to the police station. So there's in some cases whereby a lady is pregnant and the boyfriend, maybe the husband, is telling the lady to abort the pregnancy. So as a lady, since you know the complication of aborting and you don't want to die, or maybe you don't want to have some infertility or future problems, future disabilities, so you can report to the police to say my man or my boyfriend wants me to abort the pregnancy, and you are protected. You also have the right to refuse. And also as a man, maybe your woman wants to abort but you want the baby, you also have the right to report that person to the police station. And then in some cases whereby a person has done abortion and then there are some severe bleeding, you can also take that person to the nearest clinic or hospital. And then you can also report to the community health workers for fast treatment. Yes, so as I earlier stated, you can report to the community health workers, and not only that, you can also report to the Ministry of Health, which is the district officers or provincial officers. So this is what I wanted to share with you. Please protect yourself. Make sure you report these cases to the nearest hospital, police station, community health workers. It's for your health. It's your life. Thank you for watching. Bye-bye.